with you all today. Like you said, I'm Lauren. I'm our Ventures Director here at StartUpHealth, and I'll be spending the next hour up here with you and 12 of our amazing healthcare transformers, starting with these 4 in front of me. Love for each of you to introduce yourself and share a bit about the moonshot you're working on. Erica, I'll start with you.
Sure. So I'm Erica Plybeah, founder of MedHaul, which is a certified B Corp and digital health platform that helps healthcare organizations understand their transportation barriers, but also solve for them. I was inspired to start MedHaul because of an issue with my grandmother. She was a type 2 diabetic double leg amputee, and we couldn't find any high quality, reasonable solutions for her. So I founded the company about 5 years ago now, and the moonshot that we're targeting is access to care.
Hunter?
Hi, I'm Hunter Howard, president of Hormone Therapeutics. We are a virtual or telemedicine low testosterone clinic. So all men deal with a depleted endocrine system. And so as we're growing older, a lot of people are going and asking their doctors about this. They'll ask their PCP, they might get referred to an endocrinologist. These doctors understand it, but most are not trained in it. So we provide virtual access to the doctors, to the blood testing, and to the medication delivered directly to your home through a virtual platform.
Javier?
Hi, my name is Javier Cardona. I'm the co-founder and CEO of Un2. We're a telehealth platform for Latin America. Actually, we're trying to fix the access problem in the region and also for the Spanish-speaking population. In our region, it will take you from a day to a week to just talk to a doctor. So at this point, we think that's unacceptable. We've been running for almost 6 years and actually help around 20 million patients get instant access to doctors in Latin America.
Thank you. Mehmet?
Thank you. This is Mehmet Kazgan. I'm the founder and CEO of cliexa. Very similar. I wanted to put a dent on painting patients' diagnostic profile in the EMR. So our business is really collecting information from different data points, aggregate it, and paint that picture and put it in the EMR, basically real time. That's what we do in 8 subspecialties from primary care all the way to cardiovascular.
Thank you all. There's a thread of focusing on the access piece here. And I think the last 2 years in particular, that's been a huge question for everyone. Javier, I'd love to hear a bit about the last 2 years for you, and particularly in the Latin American market, what you guys are seeing from the access side of things, but also really as a founder, your biggest lessons learned and kind of key takeaways from the last 2 years.
Sure. Well, we've been running for almost 6 years. And to be honest, we probably were a bit early to market to telemedicine in Latin America. So probably 6 years ago, even 4 years ago, it was kind of still early. But when COVID hit, we were at the right time with the right platform. So we were kind of ready to take that growth. We multiplied by 20 the number of consultations we were taking within the first 3 to 4 months. But the main thing that changed was that in the region, the end user, the patient adoption was really hard. Was coming very slow for different reasons. The other one was payer adoption. So they were still not willing to pay for digital services or consultations. And also, of course, the regulation that was not clear, was all gray. Nobody wanted to take any risk. So during these 2 years, all those 3 went away. Our company is growing. We're growing probably 20-25% every month, taking more patients, more users and customers. So it was tough for us to take all this growth in a very short period of time. But to be honest, very proud of being able to serve so many people. Our main offering, our solution is provide instant access. And we're doing that, and we're super happy for that, and just looking forward for what's coming next.
Thank you. And Hunter, I'd love to hear from you as you're looking out now, the last 2 years, and I want to say COVID is behind us. I'll say that with an asterisk next to it. But as you're looking ahead now, what do you think coming out of this pandemic? Do you think it's the biggest opportunities for founders, yourself, the healthcare system in general moving forward?
Absolutely. So for us, the access to specialists is such a key aspect to it. So 88% of the country is underserved for basic care, let alone access to specialists. So the virtual component has become now just so much more just ingrained with what is what's possible. So we are focusing on delivering our service to partners, to people directly who are going and asking their doctors about this low testosterone, but they're not really finding a solution for it. So it's a couple of interesting things that people are also learning about our program are once you're on a program, we're increasing both the health span and the lifespan for our patients, where the lifespan is that there are 83,000 U.S. veterans at low T. Once they're boosted up over 550 from a low testosterone level to a medium testosterone level, they were able to, they had lower incidence of heart attack, stroke, prostate cancer, and mortality. So people are actually living longer now on this program. So now we're trying to provide more access and more understanding about that. But then also the health span aspect for our patients. They, most patients, most people understand that you're have declining, as you're living older, declining endocrine system, you have issues with fatigue, with energy, sexual interest, sexual function, and they just were not getting the access to the right specialists to help them understand this. And so we are partnering with a lot of people who are now more willing to kind of be open to the type of partnerships to get the right specialists ingrained into their communities and so it's been a great opportunity for us.
Yeah, that's wonderful. And Erica, as you're thinking of the audience here today and those of us that have a baseline understanding of what's going on in healthcare, what do you wish that everyone knew about the area you're working in that they may not understand, or another kind of key focus for you or takeaway from what you've walked through in the last few years?
Yeah, I wish everyone knew about I don't want to say burden, but that's the term, the caregiver burden, or the burden that a lot of caregivers face when their family members don't have adequate access to transportation. And I think it's something that we all secretly stress about but don't openly talk about. Caregiver burden is one of those taboo topics because who will complain about caring for their aging parent, right, or caring for their disabled child? But unfortunately, there are not adequate solutions for these types of patients to access care. So I really wish that, I would say that's probably one of the biggest things. And even in conversations, that I have with investors or potential partners, they'll stop the conversation and they'll just talk about their personal stories, with their mom or with their aging dad or with their disabled child. And I guess I would definitely say, out of all the things, that's something that I wish that we talked more about, and I wish that more folks knew about in our industry.
It really does impact each of us, and there's a story behind it all. And Mehmet, would love for you to talk a bit about how you're seeing the industries you're working with, providers specifically, on the engagement side, and really where you see that relationship between the patient and provider moving forward from here.
Absolutely. So what I have seen after COVID hit, right, before, I'm also involved with a clinic as a provider. I'm one of the shareholders there too. It was really hard to convince providers understanding what telehealth could do before, but I think COVID kind of forced also providers to be able to use telehealth, telemedicine a little bit more. So like the network that we're providing our services, people are a little bit more open. Now they saw the advantage. On a simple manner, you can see the rescheduling cancellation rates were down. Transportation issues, even we're solving it. It was really solving the problems. Now it really shifted providers to be communicating and engaging with the patients faster and more efficient way. It's also providing patients, this can be done on this kind of platform. When we talk about patient education all the time, patients don't know really a lot of things. I'm a patient also, we don't know what services are available, how we can efficiently use those. So it really changed the norm. So it opened doors for our technology as well, because we are a wraparound EMR, but the providers are the ones that are driving the patient engagement mostly, and that really helped us in that sense.
And if you could ask one thing of anyone in the audience today, whether it's an investor or a customer, kind of the biggest thing you'd like to share with them or ask of them, what would that be?
That's a strong question. Do I get that? They didn't get that. So I think the biggest thing I will tell anybody in any business, specifically in healthcare, is like be open-minded. I think there are a billion companies out there trying to solve the problem, and they're doing for a good reason. I would say, you know, companies like us, or even bigger companies also too, they're trying to solve the problem, but I think we're really resistant to change in technology, how it builds up the culture. So even I'm telling that to myself, to tell me use another platform to build something else, I'll say, well, hold on. So I think being open-minded is one thing. That message I will give to anybody. Investors are the same way. So if you look at the problem from an investor side and provider side, take a look at it, consume that a little bit, and then see if you can actually adapt to it. That's what I would say. I don't know if that was that was a very tricky question. So,
but you answered it well. It was meant to be broad on purpose. I wanted to see where you'd go with it. And Hunter, on your end, as you're thinking a bit about the patient and provider relationship as well, particularly as it relates to the services that individuals can now find at home, what do you see as kind of the key impact or driver there that we need to see moving forward?
Let me answer that in two ways. I mean, one is, you know, that was a great answer, but you know, for me, when we started focusing on the patient, you know, very early on, we were very focused on raising money, on the entrepreneurial experience, and you know what we wanted, where we wanted to go. But the more we started just focusing on the patient, delivering kind of needs to them, where they are, what they weren't getting locally, our business started kind of growing just organically at 40%, you know, per month, based on really just on patient delivery, saying what are these people not receiving, and so there was a lot of you know, raise a bunch of capital early. We're focusing on all these different things, but then we kind of said, okay, let's kind of clear through all of the fog of all these other things that are almost feel distracting from just focusing purely on what the patients needs, where they need it, how we get it to them, and then the business has been, you know, improving incredibly well since then. So that's been, you know, that is our mantra, just focusing on the patient.
And Erica, kind of on this same thread here, as you're working with these providers, what do you, in your conversations with them or the feedback you're getting, what are their kind of biggest gaps or challenges in terms of that patient relationship?
Yeah, I think I also have to piggyback on his previous response around being open-minded, but then also truly understanding the patient. We work with a lot of providers who will literally say, we don't understand this patient, or we don't understand how to find this patient. We don't understand how to communicate with this patient or contact this patient. So I think that that's definitely one of the bigger gaps. And then just the resistance to change. I mean, we're in healthcare. We have very long sales cycles. We're still using fax machines. Over 70% of healthcare providers still use fax machines. So, you know, we have a lot of work to do. So I definitely think being open-minded would help the industry move forward. But those gaps, I would definitely say, are the ability or inability to truly understand the patient and their journeys, and then sort of the slow move to change.
And Javier, as you're working with both the patients and the providers, and really the entire system, what do you see as the biggest need in the space, or let's say biggest opportunity moving forward from here?
Well, I think there's many opportunities, but especially one could be about integration, how the information flows from one place to another, how the money flows from one place to another. There's still silos to be kind of solved in the space, but as you were mentioning, in our case, trying to always focus on the patient experience, it's been great because that proves to every specific part of a system or the ecosystem that when you actually add value to the patient, it will add value to the entire chain, and everybody will get some value out of it because of efficiencies, because of opportunity, because of medical outcomes, whatever it is. So in our case, always focusing on the patient experience, because nowadays I'm usually talking to one of our patients, to many patients a week. I try to do that, and some of them said like, I'm not doing a follow-up again in person, so there is no way I do that. So everybody starts to see there is value created, that it wasn't there, or at least it wasn't clear, and probably it's more willingness to work together, and in the end, patient experience gets improved.
Yeah, I think the world can use that in general, of all of us working together. Okay, and as we wrap up, I'd love to hear from each of you as you're thinking on the long-term vision here, 5, 10, 15 years from now, as you're each dreaming it up. How is the world different because what you're building? What's the impact 20 years from now? Mehmet, we'll start with you.
Yeah, I think from our side, very quickly, we're all about enabling data and aggregating for the providers and then for the patients at the same time. 5 to 10 years, I think we talk about AI, we talk about robotic technology. If we can really put meaningful data, the data that matters, I call it, and when it's necessary and how people want it, I think that's going to make a big change. The real AI will work with real data. So,
Javier?
Well, at the beginning, I was saying that in Latin America, it will take you from a day to a week to just talk to a physician. So 5, 10, 15 years, I think there will be a place, probably we are going to be that place, where you just pick up your phone and be able to just have primary care solutions instantly. And that should be possible kind of everywhere, because either you solve your problem or you get routed to the next level of care that you truly need, and it's done in an efficient way. So I think that pick up your phone will be a reality in no more than 5, 10 years.
Awesome. Hunter?
So 100 years ago, life expectancy was 38. Today it's 78. But we also have half the testosterone levels that our grandfathers did at our same age, because there's so many exogenous factors and kind of what's in our systems. And so we're living longer, but our endocrine systems are getting depleted. So understanding kind of what hormone replacement therapy can do to help you live longer, increase your lifespan, also to increase your health span by just improving your energy, your ability at work, your ability as a husband, your ability as a father. And so understanding that and kind of just improving the second half of your life. And it's a real opportunity that we look forward to playing a big part in.
Thank you. And Erica?
Cool. I think for us, I mean, we have, of course, our metrics that we want to meet. So millions of rides completed, millions of dollars going to our transportation partners who are small businesses. So there's an economic development component as well. But the ultimate mission or the ultimate goal is that patients have the freedom to participate in their own care, and that's all patients. So regardless of income status, disability or ability, patients truly feel empowered and truly have the freedom and the solutions to participate in their own care.
Love it. Well, thank you, each of you, for being up here today. Let's give them a round of applause as they head off.
Yeah.
Thank you all.
thank you.